Hi, everyone. This is Ken with Ken's Insurance Agency. We are a full insurance brokerage. We are coming to you today to talk to you about our Medicare products. Um, we're going to go by our slideshow that we use for our Medicare education for our part of it, and then we'll give you basically a little bit more in-depth information. We are still in the 2019 enrollment plans, so we will not be looking at 2020 till open enrollment period. So let's get started. So Medicare consists of Part A, Part B, Part C, a supplement, and Part D. It's meant to help with certain disabled people and seniors. So that's basically who it covers. Open enrollment is October 15th through December 7th. You also have a special enrollment period starting with the 3 months before your 65th birthday and the month of your 65th birthday and 3 months after your 65th birthday. There's also special enrollment periods for certain people, like those on Medicare and Medicaid, and those with chronic illnesses. Also, those that move into a new coverage area where their old plan is no longer being offered. Also, if a plan goes away in the middle of the year, that can open up a SEP. So these are things that you can face. There can be penalties if you don't have Part A, Part B, and Part D around your 65th birthday. There it, or if the coverage lapses. Oh, the around the 65th birthday is a little loophole because if you're still working and covered under your employer's coverage and it's credible coverage, then Medicare will grant you Medicare Part A and basically allow you to wait on Part B and Part D till you fully retire. Um, the October 15th through December 7th, you'll have that enrollment period every year. There are some special enrollment periods, but they basically are heavily governed as to how we can market them and how we can do them. So let's go back here for a second. Medicare Part A covers inpatient hospital care, skilled nursing facility care, long-term care. Most people don't pay a Part A premium. If you pay Part A premium, you'll pay in 2019 up to $422 each month. If you paid Medicare taxes for less than 30 quarters, the standard premium is $422. If you paid Medicare taxes for 30 to 39 quarters, the Medicare Part A premium is $232. You'll pay on top of any kind of premium if there's any. Although usually most people don't have a premium with Medicare Part A, but you'll have a deductible of $1,340 each benefit period. A benefit period is up to 90 days. After 90 days, then you have to be discharged. And then when you go back into the hospital, you start with a new deductible, new co-insurances. After your deductible is met, the first 60 days is zero co-insurance for each benefit period. Day 61 through 90 is $335 co-insurance per day for each benefit period. Days 91 and beyond, it's $670 coinsurance per each lifetime reserve day after 90 days. Up to 60 days over your lifetime. So basically, you got 60 days from 91 to wherever that 60 ends you, and that's it for your lifetime reserve days. After that, it's all costs to you. Medicare Part B covers two types of services: medically necessary services, which are services or supplies that are needed to diagnose or treat your medical condition and that may meet accepted standards of medical practice. Preventative services, healthcare to prevent illnesses like the flu or detect at an early stage when treatment is most likely to work best. You pay nothing for most preventative services if you get the services from a healthcare provider who accepts assignments. Part B covers things like clinical research, ambulance services, durable medical equipment, mental health, inpatient, outpatient, partial hospitalization, getting a second opinion before surgery, limited outpatient prescription drugs. Two ways to find out if Medicare covers what you need. You can talk to your doctor or other healthcare provider about why you need certain services or supplies. Ask if Medicare will cover them. You may need something that usually covered, but your provider thinks that Medicare won't cover it in your situation. If so, you'll have to read and sign a notice. The notice says that you may have to pay for this item or service or supply. Medicare coverage is based on three main factors: federal and state laws, national coverage decisions made by Medicare about whether something is covered, local coverage decisions made by companies in each state that process claims for Medicare. These companies can decide whether something is medically necessary and should be covered in their area. The standard Part B premium amount is $134 or higher depending on your income. However, some people who get Social Security benefits will pay less than this amount, $130 on average. Also, you'll have $183 per year deductible. Once your deductible is met, it's typically a 20% coinsurance for any Medicare approved amount for your doctor services. Medicare Part C, also known as Medicare Advantage, is a plan that will cover your medical and doctor. It is provided by a private insurance company, must have Part A and B, usually includes Part D. It's very affordable. Price rise can range anywhere from $0 up to $100, and depends on basically the plan, the company, and basically what's needed. Has deductibles, copays, and coinsurances. Usually comes with extras like the ability for free gym membership, hearing, vision, dental. So these things are added value things that you can use to help you with your health care. Medicare supplements, a way to pay for your out-of-pocket expenses, must have Part A and B, cannot have Medicare Part C. Part D is sold separately. It's more expensive than Part C, broken into different versions: A, B, C, F, F high deductible, G, M, and N. As of this open enrollment, F and F high deductible and C will no longer be offered. Can have a deductible and copays and co-insurances. Usually does not have extra services like hearing, vision, dental, and does not come with a free gym membership usually. Medicare Part D, PDP, prescription drug coverage, provided by private insurance companies, must have Part A and B, can be part of a Medicare Advantage, Part C, or sold with a supplement as a second product. If you have Medicare Advantage plan, you must buy it with the Part D that is included in the plan. You'll have a formulary. These formularies are approved by Medicare. They can change within the year, but they generally do not. If they do, it's usually because a drug is being discontinued. If they do not cover a drug when you get on the prescription drug plan, you'll be given 60 days to either find another drug that will work or to be able to prove that that drug is medically necessary to where an exception can be allowed. You'll make these payments throughout the year in a Medicare drug plan. Premium, yearly deductible, co-payments and co-insurances, cost in the coverage gap, cost if you get extra help, cost if you pay a late enrollment penalty. The drugs you use, the plan you choose, whether you go to a pharmacy in your plan's network, whether the drugs you use are on your plan's formulary, whether you get extra help paying for Medicare Part D costs, all go into your actual drug plan cost. So you will have a monthly premium with this. It varies from company to company. And if you have a late enrollment penalty, it can be up to 1% of each month that you went without credible coverage. Deductibles vary between Medicare drug plans. No Medicare drug plan may have a deductible more than $415 in 2019. The amount you pay for each prescription after you paid your deductible, if your plan has one, is either a copayment, which is like $10 per drug, or a co-insurance, which would be like 25% of the cost of the drug. Medicare prescription drug plans use tiers. So the cheaper drugs are in the lower tiers and usually get paid more so that you save more money on them. And the more expensive drugs are in the higher tiers so that you pay more for them out of pocket. The coverage gap starts at $3,820 total spent. And then when you reach $5,100, you exit the coverage gap and enter what's known as catastrophic coverage, where you pay very little for your drugs. During the coverage gap, you're paying anywhere from 35% on your drugs, usually. Then you can have supplements for Medicare. These are health supplements that specifically are designed to provide a little cash back off your medical expense. That can be anything like cancer, critical illness, hospital indemnity, a Medicare gap plan, dental, vision, um, even a possible hearing policy to add to any hearing and dental and vision coverage you got. So this gives you the information on that. Um, we hope that we've provided enough information. We do recruit Medicare agents. We are also recruiting for our other positions. We are a full insurance brokerage, so we can help you with all your insurance needs, no matter your age. We can usually work within most budgets, at least most budgets that are realistic. Um, and we try to save our clients the most money while providing the best coverage possible. If you would give us a call, our number is 662-292-6271. Again, that number is 662-292-6271. Or you can go to our website, KENSINSURANCEAGENCY.net, and see more information and be able to give us a contact. Thank you and have a nice day.